Happy Perioperative Nurses Week, and welcome back to our mini spotlight series highlighting perioperative nurses from across the globe and celebrating the international impact of OR nurses. Today, we're traveling to Spain and we are speaking with Esther Espunes Mestres. Esther, thank you so much for joining us today.
Thank you. It's my pleasure to collaborate with you.
I am so excited to have this conversation. We have talked with a nurse from England, we've talked with a nurse from New Zealand, and a nurse from South Africa. And so now we are jumping back to another continent, another country, and going to Spain. And I'm so excited. But why don't you just take a second and introduce yourself to everyone watching and tell them a little bit about who you are?
I'm a perioperative nurse for 27 years. I have always been in OR since I finished my university degree. In Spain, we have all the roles. We are scrub nurse. We can do circulate as a circulator nurse as well, and in the post anesthesia care unit as well. So it depends on the hospital you work. Maybe sometimes you just scrub or you circulate or you do your activity in the post anesthesia care unit. And sometimes, for example, in my experience, sometimes a week I work as a scrub nurse or a circulator or just a post anesthesia care unit. So it depends on the hospital you work, the role you will perform.
Interesting. So in the States, when you work in the operating room, typically you are only in the operating room and they hire different nurses to work in the post anesthesia unit. And so we don't typically venture into recovery unless, they're desperate for help or need something. So that's interesting that you will work in both departments like that. I think that's really cool. So tell me this, you went from university to the operating room. How did they prepare you in school to go to the operating room?
Yes, in the university, the education degree for nursing, it's a 4 year degree.
Okay.
We are in the European space for higher education. So in Europe, most of more or less we do the same.
Uh-huh.
Our education degree is about 240 European credits, so it's about 6,000 hours of education.
Wow.
And of these 240 credits we do for nursing, 93 are in practicum and in simulation activities. So it's about 2,300 hours of practical education of nursing. In Spain, the specialty of operating room nurse, it's not recognized by the government.
Uh-huh.
It is not. We have some specialties that are recognized and they do a 2 year residency program, but the operating room nurses,
not get that.
we are not there. Not
need
yet.
to be.
Not yet.
Maybe one day.
Not yet. Yes. Yes. We are fighting hard with that, but not yet. But we have specialties for mental health, occupational health, pediatrics nurse, geriatrics, midwifery, and community nurse, for example, but
really?
not for operating room.
Well, we need to get the operating room in that specialty group, don't we?
Yes, we need to be there, but not yet. When you finish the university in the last course, so in the 4th year of education, you have one class from critical nurse assistant, and there we study intensive care unit, emergency, and operating room.
Oh,
this
okay.
is only one. I don't know the name for that, but it's like one of the hours of our formation.
Uh-huh. Yeah, like a unit, or like during one semester, that might be one of your classes.
Yes, it's one semester. It's
okay.
A 1 semester class. Yes,
okay.
And when you finish, as now we are in a lack of nurses from everywhere. By now, actually, you can finish university and start in OR, so you don't need experience.
Wow.
But when I finished 27 years ago, you need a postgraduate degree in nursing, in operating room for perioperative nursing. This
Really?
was, yes. So before, as there were a lot of nurses, they could choose who was better prepared for that. And the postgraduate, now there are still are postgraduates, but they are not necessary because the lack of nursing pushes people to go into OR without
Right.
having the education.
They got to have the people.
But
Sure.
yes, we have a postgraduate degree, which is about 30 European credits, 30. And if you want, you can do a master degree of perioperative nursing, which can be about 60 credits, European credits. So we have the tools to have a good training,
Yeah,
but
sounds like
by now, it's not necessary. It's not mandatory. It's
that.
necessary, but not mandatory to do it.
Yeah. So I'm
So
curious about the postgraduate. There's a postgraduate study that is just perioperative nursing. What do you
yes,
study in that setting? Is it like Periop 101 type training stuff, or does it go deeper than like just in
yeah.
the OR? What does it
During
do?
during the postgraduate in nursing, in perioperative nursing, you have a first semester where you learn things that how to move into a OR, or
Uh-huh.
how to practice a good antiseptic environment, for
Uh-huh.
example,
Mm-hmm.
how you need to dress yourself, or how do you need to scrub your hands. So this is generalities.
Mm-hmm.
This kind of information is in the first semester. After this, they start specialties. So they have training for all the
Okay.
specialties: neurosurgery, abdominal surgery, trauma, so
All
on.
of them. Yeah.
All of
Yeah.
them, yes.
Mhm.
So they have a little train in all of these specialties, and when they finish the theory, they go to practices to hospital.
Okay, that was my next
And
question.
the practices, yes, they finish in a hospital practicum, which is most of times about 30, from 30 to 40 days, labor days of practices in OR. So they can put in practice all they have learned during the whole course.
That's really cool. Wow. Okay. So then while you're going to school, when you're a student in Europe or a student in Spain, as a nursing student, some of the other people that we talked to said that while they went to nursing school, they received a stipend or they received some type of monetary reimbursement to go to school. Does anything like that happen in Spain for nursing, or are
No,
you responsible for all of your tuition?
we need, no, we don't have, for when you go to the public universities,
Uh-huh.
the taxes are not so high,
Yeah.
and sometimes you can ask for some reimbursement. It's not like a reimbursement, but
Like a
it's like a,
scholarship.
yes, a scholarship, yes.
Okay.
And some people go to university with these scholarships, but other don't, and they have to pay the university and the postgraduate and master's degree by themselves. So
That's very
it's
similar to here.
yes,
That's very
yes.
similar to what we're used to. I was really shocked when I heard about people receiving stipends and salaries while they went to school and then in their training. I was like, wow, okay, that's really
No, for
different.
example, what is happening now is that our students from in their last year of education at university, some hospitals pay
Hmm.
the last course, so they can, if they go to their hospital to work.
Oh,
So
yeah,
it's
okay.
a way to promote,
Incentivize. Yeah.
yes,
Hmm.
to promote their hospital,
Yeah.
and they pay the financial tasks of students
Okay.
in their last course, and you need to remain at that hospital. I think it's for 2 years. So
Okay, well that's really cool.
they pay
Yeah.
for you. They pay
And now
for
you
you,
pay them
but
back.
you need to pay back
Yeah.
staying 2 years
Yeah.
at that hospital. But it's
Okay.
a way that they are trying to catch some people to get to their hospitals.
Yeah, for sure. Well, I can totally see how that would be really beneficial because in your clinicals, while you're training, you're learning that hospital, you're getting through figuring everything out how it works there. So then you can just step into a job. And I'm sure they don't have as, they do have to train them for sure, but they don't have as much of that orientation and training because the person worked there during their last semester as a
Yeah,
student, right? So I
yeah,
can see that really, that's a good benefit. I like that.
yes.
All
I
right. So,
think it
go ahead.
benefits both
Oh,
hospital
yeah.
because they recruit novel nurses,
Yeah.
and for nurses because they don't have to pay the registration of university.
Right, absolutely. So I'm curious to talk a little bit about what it's like in the OR, in your experience when you were new to the operating room and when you started working in the OR. I'm curious about the OR culture, the interactions between other nurses and new nurses, or surgeons to nurses, or how people treat each other in the department. What is it like what has it been like in your experience?
Well, when I start a long time ago, all the students that were in OR, we went always with a veteran nurse, so we always had like a mentor
Uh-huh.
to get into OR. So the mentor tried to help you and to make you more comfortable. I think that was a very good for me in my experience. That was a very good idea to do it because sometimes when you are new, OR maybe can be some kind of scary
Yes, it can.
and can be some kind of scary, and sometimes the relationship between the teams, not just nurses but surgeons, anesthesiologists and so on, can be sometimes difficult as well. So I think that when I started a long time ago, having a mentor was really good for me because um, it was like a way to enter into this in a zone that you didn't know nothing about,
Yeah.
and having someone beside you helping sometimes just you just need to look for her, for example.
Right.
And when yes, it was I think it's a good idea to have mentors in OR. And my experience when I start with this issue was really relevant. I think that unfortunately there are some relations in OR that we all know, and it is all in literature as well, that there are some kinds of individuals that sometimes make the team not go
They can be
as good as
difficult.
they go. Yes,
Right.
and I think that if you have a veteran person beside you, makes it easy for you and for the team. And I think it's important to have a good leadership in OR, because sometimes it's not just to know something, but to know how to do, or how to say, or how to explain something. And I think that young nurses need to recognize someone as a leader
Absolutely.
in OR, because it's not just surgeons or anesthesiologists. Sometimes nurses,
Yes.
we are enough with us.
We-
So
We're we're hard enough to deal with sometimes. We don't need to bring
yes,
others into this.
yes, it's so. I think that relationships,
Yeah.
it's because it is a very close department.
Mm.
It's a department with a really high stress, and it's not easy to go forward if
Yeah.
you don't have your mental capacity to
Yeah.
sometimes to take a look so close.
At
So
the big picture, try to see the
yes,
big
take a
picture
big
of it all.
yes,
Yeah.
yes, that. And relationships always will be difficult in the time when stress
Yep.
and when things go wrong. It's it's really difficult to keep calm, but with experience, all the things you see the things different as well. I don't face things the same way now that when I started 27 years
Absolutely.
ago.
Yeah.
So experience helped you with that. But I think that we need to sometimes to just get calm and try to get apart a little bit, uh, think about that, and after just answer. Because if you answer when you are really, I don't know, really angry,
Yeah.
it's not a
Never
good
going to
tip.
be
It's
good.
better. No, it's better just to wait.
Wait a minute. Yeah.
Think. Yes. Wait a minute. We say here in Spain, we say count to until 10,
Yep.
and afterwards go and afterwards come back, because if not, it's not a good deal.
Yeah, yeah, no, that holds true no matter what country you're in or what OR you're in. Take a minute, take a breath,
Yeah.
and let's not speak in the heat of the moment for sure. So I'm curious too. You said that y'all are taught to scrub, you're taught to circulate, you're taught to work in recovery. Do you have surgical technologists in your ORs in Spain, or is it all nurses that are doing the scrubbing in your departments?
In Spain, it is mandatory to have two nurses per
Okay.
every operating room, at minimum two. You
Okay.
can have you can be three, one for
Really?
anesthesia, one
Uh-huh.
for scrub, and one for circulating. Added to this, we have some technicians that help during circulating.
Oh, okay.
During the circulating role, we have some technicians that they can help with this role, but we don't have one for each OR. So we have maybe one shared between two.
Right.
So we use them to start faster and to finish faster,
Oh, yeah, for
to
sure.
to start the next case on time.
Oh, right. Okay. That I see that. And so they are there just to assist the circulator, the RN circulator, to make sure that things go smoothly, you are efficient and
Yes,
productive, and
yes,
maybe give a lunch break or two and make
yes.
sure.
They maybe there is a problem with the patient, and when if there is not any anesthesia nurse, that some hospitals don't have it,
Right.
the circulating nurse is the one who helps first to the anesthesiologist.
Okay.
So sometimes these technicians can help. Meanwhile, the circulating nurse is helping anesthesia with the, I
All
don't know,
right.
airway problem, for example.
Yeah, no, that's really interesting. It's always nice when you have an extra set of hands and you have the help that you need, especially in a crisis, just
Mhm.
to be able to get through that. That is really interesting. Okay, so the last thing I'm curious about, and I'm not sure if this applies to the OR in Spain, but with the other people I've talked to, I've run across different names for people in the OR. And so, like in the States, we have our OR circulators, our staff nurses, and then it goes up to like your charge nurse or your board runner, and then it might be a manager or then the director. But other places they call their charge nurse or their board runner is called sister or their matron or this other names. And so I'm just curious, how do you refer to the leaders in your department? Are they just manager or do they have a different title?
We don't have the names you have explained to me. I think that maybe it would help to describe better the roles of each one.
Sure.
But yes, I think. But no, we in OR we have like a chief of department,
Uh-huh.
and we call them nurse supervisor.
Yeah. Okay.
This is like the manager of
Right.
OR. And afterwards, we have like a nurse coordinator, who I think that's the same of the charge
Yeah.
nurse.
Running the board
So
thing.
yes, they do the work to assure that all ORs go on time.
Mm-hmm.
And I don't know, maybe there are some needs that have to be taken in care. Then they do it. But we don't have. And sometimes even in not in all the shift we have two. Sometimes we have only one in the as supervisor, and we don't have, for example, coordinator. It depends on the shift. For example, the morning shift has, the afternoon shift sometimes,
Uh-huh.
and at night sometimes.
It just depends on who's there, right?
Yes.
Okay. Well, this has been so informative. I have learned so much from you and hearing what it's like in your part of the world. So before we go and before we wrap this up, do you have any advice maybe or encouragement that you want to share with any of the other nurses who might be watching this video?
Yes, I would say that OR is an incredible place to work. I think I couldn't have found any place better than that to do my job. And when you start, everything looks very, very difficult.
Mm-hmm.
Sometimes when you start, you think that you cannot be able to do it, but you are.
Mm-hmm.
You just need to look at your uh, surroundings. I don't know if it's that,
Yeah.
and look for someone to help you. I'm sure I'm sure because of a lot of years that I'm in OR that there will be always someone that will help you and that will make the things easier for you. So just have a look and look for a mentor. And I think that that would help and just make things easier. But OR is an incredible place to work, and you will find there teamwork. You can practice technical skills, and it's an amazing place. So I will recommend, highly recommend OR, our perioperative nursing. Yeah,
Yep.
really.
Well, and I will second everything that you said because I also highly recommend it. I think it is the best possible department we could work in as nurses. And I am obviously an OR nurse myself too, so I'm very fond of perioperative nursing. But this has been wonderful. Esther, thank you so much for taking the time to join us today. I really appreciate it.
A pleasure for me. I hope my English has been good enough to explain myself, to make myself clear. So
It was
thank you
very
for
good.
your time. Thank you.
Absolutely. Well, everyone, that is going to do it for today. Tune in tomorrow for our last video of the week. I'm your host, Melanie Perry, and on behalf of Esther and myself and our whole team, thanks for tuning in to First Case.